Do you, Deepak, use over-the-counter medicines or prescription medications, or do you use purely alternative therapies, subtle action?
I don't use either because I don't get sick. I'm being honest. So I don't use. But, I think you should know that 80% of prescription drugs are of optional or marginal benefit. So that means if you didn't use them, it wouldn't make a bit of a difference to the natural history of your disease. If you have one, it would save you money and side effects. Have you ever watched a commercial for minor drugs on television? You can take this for your dyspepsia, but be careful, it can lead to anything from impotence to death. Okay? It's 80%. Now, we have this huge debate on healthcare reform. It's not about healthcare reform. It's about insurance reform, which is necessary too. But we're not talking about healthcare reform. You want really healthcare reform? Look at 2.5 million surgeries that are done which are not indicated. $700 billion of lab tests that are not indicated. Why do you think there are 4 times as many lobbyists in Washington on healthcare than there are congressmen in Washington? We spend $2.4 trillion a year on healthcare. We don't even rank in the first 30 in the world in healthcare. There's a lot of wastage in healthcare. And much of what is being talked about end-of-life care is end-of-life suffering. We prolong end-of-life suffering. We do not prolong end-of-life life. So if you want to get really true healthcare reform, look at 80% of the diseases that are preventable. 80 to 90% of your healthcare dollars go into diseases that are preventable. So we're not even close to really good healthcare.